So let me give you the clarity on 26 modifier, TC modifier, and global service, because the two most important questions in interview. Okay. Then I'll go for breast mammography.
Okay, sir.
Fine. Thank you. All right. So the modifier 26, which is called professional component, and this one mainly represents physician's work. So also like supervision of the test, interpretation, supervision of test, and interpretation of the results, and writing, signing of the final diagnostic report. And so these are the scenarios where we can use modifier 26. Modifier 26. So make sure that the physician who is providing, like, he is supervising the test, he is not performing the test, he's just supervision of the test, or he's writing the results, or here writing the and signing of the final diagnostic report. And in such cases we can use modifier 26, professional component. So opposite to this modifier 26, we have a modifier TC and the modifier TC. So this is about technical component. Technical component. So this technical component represents the cost of the facility kawachu, equipment kawachu, technicians, infrastructure, and supplies. And supplies. And so that need to, supplies that need to physically perform the test, and the supplies physically need to perform the test. And it is billed by హాస్పిటల్ కావచ్చు, లేదంటే ఇమేజింగ్ సెంటర్, సపరేట్గా ఇమేజింగ్ సెంటర్స్ ఉంటాయి కదా, సో ఫర్ దట్, ఆర్ క్లినిక్ దాట్ ఓన్స్ ది మెషినరీ. సో వీళ్ళకి మనం టీసీ మోడిఫైర్ ఇస్తాం. సో 26 ఈజ్ ఫర్ ఫిజిషియన్, టీసీ మోడిఫైర్ ఈజ్ ఫర్ హాస్పిటల్ కావచ్చు, టెక్నీషియన్ కావచ్చు, ఆర్ సమ్ క్లినిక్స్ అండి, ఆర్ సమ్ క్లినిక్స్. సో దట్స్ అబౌట్ టీసీ మోడిఫైయర్. నౌ there is a thing called global service, and there is a called global service. So the global service means, it is most important, listen carefully, when the same provider or practice owns the equipment and performs the interpretation. They bill the only CPT code without any modifiers. So global service meaning ఏంటి అంటే, ఇప్పుడు ఫర్ ఎగ్జాంపుల్ I am the physician, I only given the results, that's called global service. Or I am having a clinic అండి, so in my clinic there is a machinery, and of course the technician is there, he's performing, and I am giving the interpretation. So no need to give any modifier here, because I'm going to give salary to my technician, but I'm getting the payment from insurance company. So make sure that when the same provider or practice owns the equipment and performs the interpretation, code only the CPT without any modifiers, without any modifiers only. But this is clear, right? When the physician, suppose I don't have this image like the machinery in my clinic, or I'm just giving the interpretation, and the person went outside of the imaging center, let's like a Vijaya Diagnostic or some other Yoda Diagnostic, whatever it may be, they went outside and they get the chest X-ray done and come back. So what I did, I reviewed the report, I given only the interpretation. So for my service, the coder will code the CPT, radiology CPT, and add 26 modifier. That's called I only provided professional service. But whereas imaging center, like Vijaya Diagnostic Center, that code, same CPT code will add and give the TC modifier. That is a technical component. Sir, why? What's the difference here? When you add these modifiers, the 100% payments will be split into, let's take as an example, even I told you earlier also, 60 to 70% will go to the technician and the other 30% will go to the physician. So I hope you understood, right? Modify 26 TC and global service.
Yes, sir.
Yeah, very nice. The next one. So if I want to give you a clear comparison here, professional component, so which is a modifier 26, modifier 26. So the this will be given for who builds this one. First thing, who builds this one? Who builds this one? So the interpreting physician and the interpreting physician. Then who is physician? Physician may be radiologist, cardiologist, neurologist. You understood, right? So anyone, not only the radiologist, even cardiologist, neurologist, or gastroenterologist, all will call it as a physician. They can bill with the 26 modifier. They can bill with a 26 modifier. Okay. So what are included in this 26 modifier? Usually they will supervise the imaging or data analysis and written medical report only. So let me write here. Written medical report. And the reimbursement, which is, let's take a 40% of the total global fee and 40% of the total global fee. If it is 200, let's take in that 40% will go for the physician. Okay, so if it is 100 rupees, let's go 40% will go to the physician. So this is what the professional component, which is modifier 26 and D. So make sure that any physician is giving the interpretation or he is analyzing the data and writing the report, we need to add a 26 modifier to that particular CPT code, which is 7 series. And of course, sometimes we can also use for 8 series also. The 8 series is what? Pathology and laboratory. Got it? Pathology and laboratory.
Laboratory. Yes, sir.
Yeah. Let's see. Hope you understood now. 26.
Yes,
Yeah.
sir.
Let's go for TC. So as I told you that the TC is, which is a technical component, and modifier is TC and yeah. So the facility or equipment owner, example, hospital, diagnostic center. And what included here? That means who builds this one means the facility equipment owner, and those people can build this TC modifier. Who builds? And what included here is nothing but equipment, technologist, labor, room overhead, and supplies. These are all included in this. And coming to the reimbursement, 60% of the total global fee. Now it is matched, right? 40 plus 60, how much? 100%. So this is about technical component and so that's what radiology coder have to be very careful when to use 26 modifier and when to use TC modifier, and when not to use TC and 26. That means no modifier. That I'm going to tell now. So that is called global service, and that is called what? Global service. So where we can consider no modifier. No modifier should be appended here. Okay. So who builds this one? Private practice owning the machine and employing the doctor and what is included here? Both professional, both professional, both professional expertise and facility or technical execution. So coming to the reimbursement, how much can you guess?
100%.
Yes. So reimbursement 100% of the total global fee. So this is what 26 TC and global service. And the global service means suppose I'm having my own imaging center. I employed one doctor and so no need to give any modifier. No need to give any modifier. So I'll get that CPT code 100% payment. Done?
Yes, sir.
Okay. And another one, which I called even earlier also I told you, S&I. What is S&I?
Yes, sir. గుర్తుకు రావట్లేదు సార్.
Supervision and interpretation.
Yes, 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 sir.
Supervision and interpretation.
Interpretation.
So yeah, supervision and interpretation is nothing but they will, before surgery, during the surgery, and after the surgery also, they will monitor, and that is called supervision and interpretation. Okay, fine.
Okay.
Now, let me give you one example on this TC modifier and 26 modifier. Then we'll go for breast mammography.
Okay, sir. సార్ వీటిలో ఓన్లీ ఇవే మోడిఫైర్స్ యూస్ అవుతాయి, ఇంకేమైనా వస్తాయి ఎక్స్ట్రా? లైక్
52, I told you, no?
77.
52 will come, 76 will come, 77 will come. 76 ఏంటంటే repeated procedure by same physician అండి.
Yeah.
Okay. Yeah, I'll come to that part. And 52 చెప్పాను కదా, 52 కూడా reduced service కూడా వస్తుంది.
Yes, sir.
Okay. But main గా they will focus on these modifiers అండి, ఎందుకంటే the radiologist, ఈవెన్ రేడియాలజీ సిపిటీస్ కి పేమెంట్ ఎలా జరుగుతుంది అంటే బేస్డ్ ఆన్ దిస్ ఓన్లీ. 26 కావచ్చు, టీసీ కావచ్చు, యునో, అండ్ నో మోడిఫైర్. ఇది చాలా ఇంపార్టెంట్.
ఓకే, ఓకే.
ఓకే, దాట్ వుడ్ బి ఈజీ. 76 ఏంటంటే ఇప్పుడు ఫర్ ఎగ్జాంపుల్ మార్నింగ్ 10 o'clock కి పర్ఫామ్ చేశారండి, అగైన్ 12 o'clock కి సేమ్ ఎక్స్రే మళ్ళీ పర్ఫామ్ చేశారు, సేమ్ ఫిజిషియన్ పర్ఫామ్ చేశారు. గో హెడ్ అండ్ కోడ్ 76 ఫర్ ద సెకండ్ సిపిటీ.
ఓకే.
77 ఎప్పుడు ఇస్తామంటే ఫర్ ఎగ్జాంపుల్ 10 o'clock కి డాక్టర్ ఏ పర్ఫామ్ చేశాడు, 12 o'clock కి డాక్టర్ బి పర్ఫామ్ చేశాడు. ఇక్కడ ఏంటి, ఫిజిషియన్ చేంజ్ అయ్యాడు, 77 అపెండ్ చేయండి.
ఓకే, ఓకే.
అలా ఎన్నిసార్లు రిపీట్ చేస్తే అన్నిసార్లు ఆ సెకండ్ సిపిటి కోడ్స్ కి మనం 76 ఇవ్వచ్చు, యాజ్ వెల్ as 77. ఇంకొక ఎగ్జాంపుల్, మార్నింగ్ 9 o'clock కి డాక్టర్ ఏ పర్ఫామ్ చేశాడు చెస్ట్ ఎక్స్రే, అండ్ అగైన్ 11 o'clock కి డాక్టర్ బి పర్ఫామ్ చేశాడు. సేమ్ డేట్ ఆఫ్ సర్వీస్, సేమ్ పేషెంట్. సో 9 o'clock కి మనం కోడ్ చేయము, 9 o'clock కి ఓన్లీ సిపిటి ఇచ్చేస్తాం చెస్ట్ ఎక్స్రేది. ఓకే.
ఓకే, సెకండ్
అండ్
సిపిటికి
11 o'clock ఏదైతే సేమ్ సిపిటి ఇస్తాము, ఇచ్చేసి 77 ఇస్తాం, ఎందుకంటే డిఫరెంట్ ఫిజిషియన్.
డిఫరెంట్ ఫిజిషియన్.
మళ్ళీ 12 o'clock కి ఆర్ 1 o'clock కి డాక్టర్ ఏనే పర్ఫామ్ చేశాడు, దెన్ మళ్ళీ సిపిటి ఇస్తాము, 76 ఇస్తాము.
ఓకే ఓకే.
అలాంటి సినారియోస్ కూడా ఉంటాయి, బట్ దట్ వుడ్ బి వెరీ రేర్ కేసెస్, ఎందుకంటే మనకి ఒకటే ఫిజిషియన్ చేస్తాడు. వెరీ రేర్ కేసెస్ లో డిఫరెంట్ వచ్చినప్పుడు 77 అనేది గుర్తుపెట్టుకోండి.
ఓకే.
Done. So a patient visits with a freestanding, independent imaging clinic for a chest X-ray and independent radiologist. So which is not employed by the clinic and not employed by the clinic. So reads the film from home and submits the written report. Let's take the CPT code for this procedure, which is a chest X-ray. I'm giving the code 71045 only. Now, if you are billing for clinic, how will you code this scenario?
క్లినిక్ అయితే టీసీ ఇస్తాం సార్.
Yes, we can give TC modifier.
టీసీ
If you are giving for billing for radiologist,
26 మోడిఫైర్.
that's it, ma. 71045 26 modifier.
26.
Okay. So hope you understood, right?
Yes, sir.
Okay. So let me give you last example for this case. A patient goes to their private cardiologist office for an electrocardiogram, which is called ECG. The practice owns the ECG machine, a practice nurse hooks up the leads, and the practice cardiologist interprets the rhythm strip on site only. Now let's take the CPT code for ECG is, let me give you 93000, 93000 only, 93000. Now my question here, do you add any modifier?
నో సార్.
Why?
ఇది గ్లోబల్ సర్వీస్ కింద కన్సిడర్ చేస్తాం కాబట్టి ఫిజిషియన్ ఈజ్ ఓనింగ్ ద ఈసీజీ మెషిన్.
Yes, because the patient, private cardiologist office for ECG, right? The practice is having ECG machine, and of course the nurse is setting and the practice cardiologist is interpreting. So we don't use any modifier here. This comes under global service. This comes under what?
గ్లోబల్ సర్వీస్.
Exactly. This comes under global service only. So I hope you got it right. The 76 modifier and 26, sorry, TC modifier and 26 modifier.
Yes, sir.
Okay. Fine. Let's discuss about breast mammography. So when we are going to see this breast mammography, or like we need two terminologies here. Let me tell you, breast mammography. Make sure that whether it is screening or the other one is diagnostic. One is called screening and other one is called diagnostic. So what's the difference between screening and diagnostic? So screening is nothing but preventive only. So diagnostic is nothing but investigative. Let me write here. Preventive, screening. This is not for only this procedure. Any other procedures also, if they are coming for screening, it's nothing but preventive. And if it is a diagnostic, which is considered as an investigative only, investigative. Okay. So make sure that breast mammography, check that whether it is a diagnostic mammography or screening mammography or screening mammography. So here the screening mammography is nothing but the person is very healthy, but a family history of some cancers or tumors. For such cases, they are doing the screening mammography only. So no symptoms are there. Where the diagnostic is the person is having some symptoms only. So for that symptoms, they are ordered diagnostic mammography to confirm the condition. Do you want me to repeat?
No, sir, good.
Good, no? Okay, fine. So make sure that when you are choosing a code, check that whether the patient is having a symptoms or not. If nothing there, you just go ahead and code for screening, which is called preventive only. Then if any symptoms are there, you can consider that as a diagnostic. Okay. So there are two things here. You can see there would be a 2D mammography as well as 3D mammography. 2D mammography and 3D mammography. And that's nothing but CAD, computer aided detection. It's called CAD. They might ask in interview what is CAD. So don't say that coronary artery disease. It's a computer aided detection. Computer aided detection. Computer
Okay.
aided detection. And
Detection.
okay. So when they are performing 2D mammography, when they are performing 2D mammography, this CAD is included in 2D mammography and we do not build this separately. We do not build this separately. So CAD should never be built separately. This is included in 2D mammography and included in where? 2D
2D mammogram.
mammography. So let me write here 2D mammography. So the CPT codes here you can see 77067 and so this indicates screening mammography bilateral and bilateral, nothing but two view, right? Bi means two view study of each breast. 77066, this code indicates diagnostic mammography unilateral, sorry, bilateral only. Seven 77065, this code indicates diagnostic mammography unilateral. So unilateral. Understood? So like this screening mammography will be there, diagnostic mammography will be there, and that make sure that whether it is unilateral or bilateral only, unilateral or bilateral. Okay. So for example, the code for screening mammography is what 77067, right? 77067, which is bilateral. So let me give you the clarity here. Usually performed on asymptomatic patient to detect unsuspected cancer early. Undetected, so unsuspected cancer early, and no physician order, no physician order or sign or symptom is needed, and sign or symptom is needed here. So which is screening mammography, and screening mammography. The word screening nothing but the person who is a asymptomatic patient, and that might be detecting for unsuspected cancer early, no physician order or sign or symptom is needed, right? So coming to the diagnostic mammography for these two CPT codes, hopefully you're aware of it, right? It is bilateral and this is a unilateral. So for this one, performed when a patient shows signs or symptoms. Example, palpable breast lump, focal pain, nipple discharge. So these are examples for symptoms, okay, or has an abnormal screening mammogram requiring immediate follow-up views. So got it right? This screening and
Yes, sir.
diagnostic. Yeah. So also please check that whether they're performing unilateral or bilateral. If that unilateral, you can use the modifier LT or RT. LT or RT. Okay. So here I want to give you one important modifier like GG. Modifier GG.
Easy.
So the modifier GG indicates if asymptomatic patient, you know, asymptomatic patient means the person is not having any symptoms. He undergoes screening mammogram, and the radiologist, you know, find out something, a suspicious spots findings. He found some spots on the breast, and immediately orders a diagnostic mammogram on the same day. On the same day.
Same.
So we can code the diagnostic mammogram and you can give the modifier GG. Okay, let me write, otherwise you'll get confused. It's nothing but same day conversion rule, especially this is for mammogram procedures. You'll get these scenarios. Okay, always remember the modifier GG, and same thing is in where, you know, the surgery, there is a colonoscopy procedure. When a person is coming for a screening colonoscopy and converted to diagnostic or therapeutic colonoscopy, there are two modifiers, and one is a 33 modifier and other one is a PT modifier. Same like here also in radiology, we have a modifier called GG. Okay, so GG is nothing but the same day conversion rule. Always remember whether they perform both the procedures on the same day or different day and day. Okay, so this modifier GG, if an asymptomatic patient undergoes a screening mammogram and the radiologist interprets it immediately, spots a suspicious finding, and orders a diagnostic mammogram on the exact same day, Andy. So you already know the screening mammography code which is 77067, correct?
Yes, sir.
And other modifier for diagnostic mammogram, you can see 77006, and 77065.
Yes, sir.
So we are going to bill both the CPT codes, screening as well as diagnostic code on the same claim only. Okay,
Okay.
so let me tell you how to build this thing. 77067. This is for
Screening mammography.
yes. This is for screening. Next, they performed a diagnostic mammogram. Okay, let me take an example. I'm taking just a code వచ్చేసి 77066 I'm taking Andy. Okay, which is bilateral. Got it. So for which CPT you will add GG modifier?
777066.
Very nice. GG modifier. You can code both the CPTs. If you do not add the GG modifier, the insurance company will deny this claim. One of the CPT code will get denied.
Okay, okay.
So because the coder not aware of this to add GG modifier, he almost coded. Let's take 5,000 reports in a day, in a month only. So there is a huge difference, right?
Yes, sir.
Yeah. So make sure that by adding this GG modifier, so the insurance company, like the payer, that the screening converted to diagnostic study, preventing a duplicate service denial. And so this is the case.
Yes, sir.
Okay. Let me give you one more scenario. You have to answer this. Okay.
Okay, sir.
Right. So, for example, they are doing a screening mammogram, which they are performing for. Let's take the code is 77066. What is 77066?
Diagnostic bilateral.
Okay, 77067.
6 screening mammography bilateral.
Okay, we have only one code for screening, but when diagnostic we have two separate codes. What is the difference here?
అంటే యూనిలాటరల్ bilateral కి separate codes.
Exactly, we have a separate course.
Yes, sir.
When coming to the screening,
Bilateral single code.
single code, but they performed only the screening mammograph on left breast. And how would you code this scenario?
అప్పుడు LT modifier ఇస్తాం లేదా
That's
రెడ్యూస్
it.
సర్వీస్ 52 modifier ఇస్తాం.
Exactly. Why you are giving 52 modifier?
అంటే బయలాటరల్ కోడ్ బయలాటరల్ కాబట్టి వాళ్ళు బయలాటరల్ పర్ఫామ్ చేయలేదు కాబట్టి
Yeah.
52
The code
modifier.
description itself telling is a bilateral, but the provider performed only one breast, right? So we need to give a 52 modifier. So
Yes,
by
sir.
adding 52 modifier, the insurance company will pay only 50% of the payment to that clinic or provider.
Yes, sir.
Okay. So the type of scenarios you will get more Andy. So please always have a look on this. Check it immediately, the code description and all those things.
Okay, sir.
Okay. Now, when coming to the screening mammogram, the ICD code for this one. So there are three codes for this Andy screening, especially the screening mammogram. Like one is Z12.31. This is for encounter for screening mammogram for malignant neoplasm. And like other thing, you can also add the history codes, and if the person is having a family history of breast cancer, the 80.3, we need to add this one also, family history of breast cancer, or a personal history also we can use, and which is Z85.3. Personal history of. Got it?
Yes, sir.
Compulsory when you are giving a screening CPT course, you have to give more this ICD codes, and you have to give this ICD codes when you are coding the screening CPT codes. Mandatory to give this ICD codes.
Okay, sir.
First
And it
code the
depends on
screening
document.
ICD, and compulsory you have to code the history code if that is documentation is supporting.
Okay, okay.
Okay, so
ఇప్పుడు డాక్యుమెంటేషన్‌లో ఫ్యామిలీ హిస్టరీ గాని, పర్సనల్ హిస్టరీ గాని మెన్షన్ చేయలేదు సార్.
no need to code.
అలాంటప్పుడు ఓన్లీ మనం Z12.31 ఇస్తే
Yeah,
సరిపోయిద్ది.
yeah, just you can code the screening CPT code, screening ICD code. That's it.
ఓకే సార్.
Okay, so make sure that the ICD codes are very, very important here. And when coming to the diagnostic, so for diagnostic, we don't use this Z12.31. What
ఓకే.
to code?
అప్పుడు మాలిగ్నెన్సీకి ఇస్తాం సార్ కన్ఫర్మ్ అయితే.
So basically, this diagnostic mammogram, we have to code. For example, I'm telling you here examples. Let's take a N63.0. Not all the cases. Example, I'm telling you here. Palpable lump. Okay, and let's take breast pain N64.4 N64.4. So this is about breast pain. So it is about breast pain, and like as an example, if there is any abnormal findings, so we have a code R92.8 abnormal findings. And so, sir, what if I do not give these ICD codes? The insurance company will deny the claim. There is no necessity. Done, no? Clear, right?
ఎస్ సార్.
Yeah.
అంటే మనకి కన్ఫర్మ్డ్ డయాగ్నోసిస్ లేనప్పుడు సిమ్టమ్స్ ఏదైతే మెన్షన్ చేస్తున్నాడో అన్నిటికీ కోడ్ ఇవ్వాలి ఐసిడి.
For example, one patient is having breast pain and they performed a mammogram. You have to code that as a diagnostic mammogram. If you code that as a screening, it is wrong, Andy.
ఓకే, ఓకే
And
సార్.
many of the coders will think that we have the codes, right? Screening mammogram is there, diagnostic mammography is there. If you
Yes,
don't
sir.
know when to use the CPT codes, the coder will use as like his wants, right? So
Yes, sir.
you should aware the difference between screening as well as diagnostic.
Yes, sir.
Screening as well as diagnostic.
Diagnostic.
So screening means when there is no symptoms. If you can understand by reading the report, if there are no symptoms, you can code that as a screening mammogram and use the ICD code Z series code.
ఓకే సార్.
If some symptoms are there, just convert that into diagnostic. You can code
Okay.
diagnostic CPT code and give the what are the symptom. You can add that symptom code to that diagnostic procedure.
ఎస్ సార్.
Okay, so which is screening mammogram and diagnostic mammogram.
ఎస్ సార్.
And if in case the screening mammography performed by technician and interpreted by a physician, how would you code this scenario?
ఇప్పుడు ఇంటర్ప్రిటేషన్ అండ్ రిపోర్ట్ కూడా ఉంటే నేను 26 మోడిఫైర్ ఇస్తాను సార్.
Same. See, The 26 and TC is applicable in all the radiology CPT codes. Don't think that is only for chest X-ray.
Okay, sir.
Okay, na? Because that won't give you the clarity. So here also you'll get the scenarios and so where the physician only interprets the report now, then you give CPT same CPT code and give the 26 modifier.
Okay, sir.
Okay, so that is very very important and if only the technician performed, if you want to code only for the technician, you can give the modifier TC.
Okay, sir. అంటే మోస్ట్ ఆఫ్ ద చార్ట్స్ 26 మోడిఫైయర్స్ వస్తాయి సార్.
26 వస్తాయి, TC కూడా వస్తాయి. గ్లోబల్ ఉంటాయి ఎక్కువ.
ఓకే సార్.